In South Sudan, the world's newest nation, access to basic healthcare is a challenge for most citizens. The country suffers from an ongoing civil war, as well as frequent flooding, which displaces many communities. The remoteness of many areas and poor road networks mean delivering supplies to those who need it most can almost seem impossible, especially during rainy season, where 60% of the country's transport routes are inaccessible. These challenges significantly contribute to the fact that immunisation coverage in the country has been less than 50%, with vaccine-preventable deaths such as measles being increasingly widespread. These cases often end fatal and affect those who are most vulnerable, children. Crown Agents has worked in South Sudan since 2012, delivering the Health Pooled Fund, working with Montrose and funded by the UK Foreign Commonwealth and Development Office, Gavi the Vaccine Alliance, USAID, the Government of Canada, the Government of Sweden, the European Union and CEDA. Working with 23 local partners, the programme provides hundreds of thousands of citizens, especially women and children, with quality healthcare, delivering services across 80% of South Sudan. To ensure children in South Sudan have access to life-saving vaccines, the Health Pooled Fund programme supports South Sudan's national immunisation campaign by promoting routine immunisations across the country. It delivers them as part of HPF's basic medical supply package across 8 of 10 states in South Sudan, followed by reaching out to local communities to increase uptake.
We have to target all the facilities and the population, which is very big. And we need to send the information first, and then mobilizers is continue mobilizing the people, and then vaccinators will start moving from the town so that they have to make 2 days or 3 days to cover the whole area.
We normally have issues with access. Most times we plan to have vaccination in areas where the vehicle cannot move, so it normally do affect vaccine delivery to these locations.
When vaccinators are organized to go for campaign to those locations, the site is there but no chair, no water, and then difficult to them to get the cap in order to organize themselves for doing the immunization.
One, we do health education, basically in the facility here. 2, we do it in the community, even in the chat, in the market, we do health education on vaccination. When people are coming, also we talk to them. The mothers are bringing their children, we give them the vaccine. They're also getting it at the same time.
South Sudan vaccine supply chain is 3-tiered, with one central national vaccine store based in Juba and the rest of the stores based at the state and country level. Due to insecurity, vaccines and injection devices are distributed directly from the Central National Store through the United Nations Humanitarian Air Service and/or chartered flights by UNICEF to states and some countries.
We have bicycle that we are using for transporting the vaccine carriers and other instruments of the vaccine to the authority site. But the problem is, our bicycle is not all good, then it may also get spoiled on the road when they are going.
Gavi received a donation of 1 refrigerated vaccine transport vehicle for South Sudan, with the purpose of strengthening existing immunisation work through HPF 3. The vehicle, a Toyota landcruiser fitted with a vaccine fridge and 16 hours of battery life, allows the safe transportation of vaccines between 2 and 8 Celsius across a variety of challenging terrains, thus maintaining the cold chain and reducing the risk of temperature excursions that can damage vaccine viability.
It's very good, it will help us because we have a lot of challenges, especially when we talk of mobile. Of course, mobile with the issues of cold chain, the landcruiser is having cold chain. I think it's very helpful to us. It will help us a lot.
The landcruiser, which carries the vaccine, we are able to vaccinate more children in the areas through the mobilization that is normally done by the Boma Health workers.
Our work has seen a 55% increase in immunisation services at health facilities, helping saving lives across South Sudan.